Hi, I'm Dr. Mehboob, MD Ophthalmology from Aiims New Delhi, and I'm back with my series Take a Sip with Ophtha that is very important because we are discussing the important topics related to the ophthalmology relevant for the Neet PG, Next PG and Fmge examination. With this, you will be able to solve the most of the MCQ just after watching 3 to 4 minutes video of each and every topics. That's very important. And so let's dwell into this SIP 13 corneal dystrophy part 4. We have discussed the 3 parts, and this is stromal dystrophy. Okay, there is one more part, that is corneal part 5, where we will be discussing the endothelial dystrophy, and that will conclude the corneal dystrophy. But here we are part 4 stromal dystrophy. Let's see. I'm not asking you to remember all these things. This is the table, a big table. I'm just asking you to remember what I have highlighted here. Okay. For those students who want to write it in the examination of their MBBS, so they can learn everything, but for you only these points are there. So we have here granular dystrophy, macular dystrophy and lattice dystrophy. These all are the stromal dystrophy, right? Now, what is important to understand the difference between them, because most of the time they will be asking. I have told you this and this are autosomal dominant, but macular dystrophy is autosomal recessive. One of the important difference, autosomal recessive, and many of the times they have asked this question. Second point, granular dystrophy does not involve limbus. Lattice dystrophy does not involve limbus, does not extend to the limbus, maybe sometime, but this macular dystrophy extends to the limbus. Okay, 2 points, autosomal recessive, extend to the limbus, macular dystrophy, right? Third point, granular dystrophy, granules and the intervening stroma. Between the granules, I will show you the photo, between the granules there is a clear zone, but here between the granules there is a no clear zone, I mean hazy zones. Okay, and lattice dystrophy is easy to identify. Why? Because of the lattices, lines, refractile lines. I will show you the picture. Coming to this, the important thing is that corneal thickness is reduced in the macular dystrophy. So we have the macular dystrophy, different types of the characteristics. One, autosomal recessive. Second, extending to the limbus. Third, thinned out cornea, right? Stain, very important. Granular dystrophy is stained by the Masson trichrome. Why? Because of the hyaline deposition. Masson trichrome because of the hyaline deposition. Macular dystrophy is alcine blue or colloidal iron. Why? Because of the glycosaminoglycans deposition. This is very important. Colloidal iron, alcine blue because of the glycosaminoglycans deposition. Third, lattice dystrophy because of the amyloid deposition. We have the Congo red staining, right? This is very important. Only see the highlighted points, nothing to remember anything else. Now I have already told you about this clear limbal zone. This is the characteristic feature of this clear limbal zone. Limbus is not involved. And lattices line, refracted lattices lines. Now we have to come to this. What is this? See, what is this? See, this is point important. This point, I mean, let me take you this picture. What is this? These are the Congo red staining on histopathology, right? So this is Congo red staining because of the deposition of amyloid. Okay? So there is a deposition of amyloid here. Okay? Now these are here, you may not be able to see the lattices, but here on slit lamp or retroillumination you will see the refractile lines here. See here. Okay, let me extend this. You can see this refractile lines, and this will tell you this is the lattice corneal dystrophy, right? Obviously I have told you that it is an autosomal dominant condition, refractile lines, and the limbus can be involved, usually not involved but can be involved, and amyloidosis, and so it is a Congo red, right? It's a Congo red staining. Moving to this granular corneal dystrophy. Can you see this? See, this is the granules dystrophy patchy, but in between them, here to here, in between them, this area is clear, this area is clear, this area is clear. I mean, see, the area between these two is clear. Between these two is clear. That's what I was telling you, that in the granular dystrophy there is a discrete opacities which having the intervening clear zone, which is not present in the macular. This is important. Second important characteristic is that it does not involve the limbus at all. Every time you will see the clear limbal zone. This is the characteristic. So you may be asked about this clear limbal zone. Now coming to this one, what is this? This is the staining of Mason trichome. So this is the staining of Mason trichome. Why? Because of hyaline deposition, and you will be able to, it's autosomal dominant condition, as I have already told you in the table. So this is very important. Coming to the third one, जिसके characteristics के बारे में we always talked about. What are the characteristics? Let me list out it here. Autosomal recessive condition, one. Second is the thin cornea, extend to limbus, okay, hazy intervening media, and this is, so it is an autosomal recessive, thin cornea, extend to the limbus, but this extends to the limbus. But let me tell you, see here there is a discrete patches, here there is the discrete patches, here, everywhere, but in between these two the intervening area is also hazy. In between these two the intervening area is very hazy, but it was quite clear in the granular. Okay, so this is the difference. Second point is that extend to the limbus. This extend to the limbus, but in the granular no extension to the limbus. Cornea is very thinned out. Cornea was normal in the granular. What is this? This you can say gray. I mean this color is because of colloidal iron. Colloidal iron staining, or you can have also there is another staining called Alcyon blue. Why? Because of the deposition of this mucopolysaccharides. And how to remember mucopolysaccharides, mu or glycosaminoglycans? Yes, that is M for macular, M for mucopolysaccharides, or glycosaminoglycans. GAG are the glycosaminoglycans in the mucopolysaccharide only, na? So M is for the macular, M is for the glycosaminoglycans. So now you have to remember, just granular is hyaline, lattice is amyloid. So very important. I mean this is the stromal dystrophy. So this concludes the stromal dystrophies of IC3D classification, corneal dystrophy part 4. We will be back with the CYP5, I mean corneal dystrophy part 5 with CYP14, where we will be discussing the endothelial dystrophy and concluding this corneal dystrophy. So 5 videos of 3 to 4 minutes will itself tell you will complete your corneal dystrophy. Just do watch whenever you get the time, whenever you are taking the sip, taking the tea, drinking the coffees, whatever, and just do this, and there is no extra time this needed. Thank you very much.